thousands of Kenyan women and some men face one of the toughest health battles: breast cancer. According to the Kenya National Cancer Registry, it's the leading cancer among women, responsible for nearly 16% of all cases. And while the numbers are worrying, experts say awareness and early screening can make all the difference. Breast cancer begins when abnormal cells in the breast grow uncontrollably. While anyone can get it, women over the age of 40 are at a higher risk, especially those with a family history, hormonal changes, or unhealthy lifestyles. But doctors emphasize one truth: early screening saves lives. Across Kenya, county hospitals and the National Cancer Institute run screening programs to make detection easier and more affordable. Simple actions like monthly self-exams, clinical checkups, and regular mammograms can make all the difference. Healthy living also helps. Regular exercise, a balanced diet, and avoiding tobacco or excessive alcohol can lower your risk. The Ministry of Health warns that lifestyle-related cancers are on the rise, but they are also preventable through better habits. As Kenya marks Breast Cancer Awareness Month, let's join Sally Limo and the guests on Family Matters as they unpack the journey of breast cancer, its challenges, prevention, and the hope that comes with early detection and community support.
Indeed, a very good morning on this beautiful Tuesday morning where we bring you matters parenting. But this time we are actually going to talk about breast cancer, just like Ita started right there. Very, very good opener, talking about the importance of early screening, you know, diet and all that. So that's the topic we're going to be discussing this morning. And when you talk about breast cancer, the two words that can actually change a life in an instant, yet behind those words are stories of strength, faith, as well as survival. So every man, every woman, and every family and every community has a role to play when it comes to raising an awareness as well as offering hope. And so today on Parenting Tuesday, we are having a heartfelt conversation about breast cancer, understanding it, fighting it, and standing with those whose lives have actually been touched by it in one way or another. And like my guests in studio this morning, each one of them is a hero when it comes to breast cancer awareness in one way or another. And here at Family Media, we purpose to keep Jesus on the airwaves through giving such, amazing content when it comes to, such topics, centered on content that really educate you, inform you in one way or the other. So Family Radio is growing right now as we speak, and wherever you are, we've been talking about Lamu. Lamu is our new baby, our new frequency, 88.5, that culturally rich part of our nation, and we are eager to actually reach families there with the same changing message of faith, love, and purpose. So as we share this message of Lamu with you, like you've been our partner, our always go-to people. You walk with us, support us in one way or the other. We just want to continue urging you and requesting you and imploring you to continue supporting us, especially in our new project, Project Lamu. So you can do that really by just sending your support to our paybill number 316, and the account number shall be Lamu. Thank you for your support, and God bless you even as you make this sacrifices for our families in Lamu. So welcome to the conversation. Remember to be part of it. You can do that too through 20316, our SMS line, or 0786 316 316. That is our WhatsApp line, and just get plugged into the conversation that really you cannot afford to not to be a part of. Help me welcome my guests in studios. My name is Sally Limo, as I welcome my guests this morning in studio. Beautiful ladies, creating impact all around us when it comes to matters breast awareness. And I'm going to start with you, Wambua, to introduce yourself to us, and then Martha will come in as well to do the same.
Thanks, Sally. My name is Eunice Wambua. Eunice Wambua is a breast cancer survivor. I've survived breast cancer for the last 9 years. Currently, I'm a cancer advocate and a counselor in training. Thank you.
Amazing. So you're a cancer advocate, you know, a mental health expert as well on that, and a survivor. Very important to note right there. Martha.
Good morning. My name is Martha Mboro. I'm a nurse by profession. I'm an advocate, a cancer advocate, breast and cervical cancer, because I don't separate the two.
Right.
And I create a lot of awareness, both in the health facility and in the communities. I also work hand in hand with these patients throughout the journey, because the disease trajectory is so devastating to the patient and also to the relatives and also to the community. So I support them.
Oh, absolutely fantastic. And that's why I said amazing ladies who are really, this is an impact that you don't know, you have no idea what you're doing out here, but you're doing a very good job. And just to start us off, and Martha, you're going to tell us why you cannot separate the two, breast cancer and cervical cancer. But to start us off, Eunice, maybe you'll tell us, take us back to, you know, the symptoms. How were you diagnosed and how was it like for you?
Back to the diagnosis. The breast cancer diagnosis came in 2016, but I felt the lump back in 2015. And because I had just finished breastfeeding, I assumed it's because of the milk.
Yeah.
But after like 6 months, I went to the hospital. When I went to the hospital, because I was below 40 years, the doctor performed an ultrasound. And from the ultrasound, the doctor told me that there was nothing suspicious. So since the doctor gave me a clean bill of health, I assumed that all was okay.
Yeah.
So I went back to my normal life. Those days, I'm a biochemist by profession. In fact, I worked in the pharma for like 25 years. So I went back to life and continued working normally. So I stayed for like 2 years. But one thing I noticed, the lump was growing. But out of ignorance and lack of awareness, I did not take a lot of concern in it.
Yeah.
But after like 2 years, I noticed that now the nipple was going inside. It was not moving anything, but it was growing to the inside. So it really worried me. So I decided to go back to the hospital again. So the second time when I went to the hospital, and mark you, this is 2 years later, I was sent for another ultrasound. From the ultrasound, the sonographer told me this thing is suspicious for cancer and I should take a lot of concern about it now. So when I went back to the hospital, the doctor told me it is very urgent and I should plan for a biopsy. And in fact, my biggest sign was a lump. And the second sign was the nipple retrieving to the inside. So when the doctor told me now that it is something suspicious for cancer, initially I was in denial and went away and disappeared for like 6 months. And in the 6 months, I did not talk to anybody about it.
Yeah.
But I dived my energy and gave my energy to work. So I could just leave home, go work without talking to anybody. I withdrew from my friends. But in the process of time, one of my friends noticed that I had withdrawn completely. So she came to the house and insisted on asking me what was not happening. So I told her what was happening, so she insisted on us going to the hospital. So when I went back to the hospital, a biopsy was performed and they confirmed that it is cancer. So then from there, I started the cancer journey.
Okay. We'll be interested just to know why, did the doctor feel the lump and why did they ignore it? If you could feel it yourself, this is an expert, they felt it and they ignored it. Probably, did you have that conversation? We're going to get into that. Martha, bringing you into the conversation, what is the role of, you know, an oncological nurse, so to speak?
Okay. Nurses in general, not even the one who is not specialized or the one who is specialized, as long as you are a nurse or a health worker, we have a role to play in prevention. We are the ones to teach the community, to educate the community. That is the health promotion. We are supposed to inform the community on the risk factors. We are also supposed to train them even how to do a self-breast examination,
Yeah.
so that you can be able to identify any sign early. Because early detection, we believe in early treatment and better outcomes.
Okay.
And we will improve the quality of life of our patients. We are also the ones to do the screening in the community, both in the health facilities,
Yeah.
the outreaches, and integrate breast and cervical cancer screening in the health facilities.
Okay.
In other services like family planning, the mothers coming for antenatal clinic, we integrate the breast cancer screening.
Okay.
Because most of our clients or most of our patients out there, they don't know you can walk into a health facility and just do a breast examination done on you, or get a health worker who can just show you or demonstrate to you how to do a breast examination. So we need to normalize breast examination in
Okay.
our health facilities, and also integrating in the healthcare system.
Okay.
Yeah, with other services.
All right.
Yeah.
And how early should, ladies, and I know it's not just for ladies actually, and we need
Yes.
to make that very
Yes.
clear. How early should someone start then the screening process, for example?
It should start as early as from 21 years.
Okay.
We've seen even breast cancer patients who are already 22, 23. So by 21 years, you're supposed to be trained on how to do a breast examination. You just show one client and she'll show like 20. So if we empower like 10 women,
Yeah.
we have empowered the whole community. Yes.
And men as well?
And men as well.
Okay.
Yeah.
Coming back to you, Eunice, because there was a misdiagnosis, do you think there was a misdiagnosis initially?
Yeah, there was a misdiagnosis.
Do you think that happens a lot in your space of advocacy?
In my space of advocacy, this happens a lot, especially for the mothers who are breastfeeding or who have just finished breastfeeding. And over the years, what I've learned, your body will always tell you when there's a problem.
Yeah.
So it is good to know your body, and it's good to listen to your instinct,
Yeah.
because they will always tell you the fact.
Okay.
Even if the first doctor tells you that whatever you are having is nothing suspicious, it is always good to seek a second opinion.
Right.
Because out of lack of awareness, I stayed with the lamb for more than 2 years, and in the 2 years it was growing. If those years I knew what I know today, I could not have gotten a total mastectomy like I had, because when I felt the lamb, it was too early for the total mastectomy.
Yeah.
Yes.
Yeah. And we're going to talk about the total mastectomy, in a few, Martha. But before that, how then can one, if you can demonstrate or explain elaborately, how can one check physically for the breast lump? How is it done?
Okay, the procedure for self-breast examination, for the ladies, even for our men, you just stand in front of your mirror,
Okay.
just straight, with your hands down.
Okay.
So you just check the breast. Is there any change? Just checking without even touching anywhere. The changes in color. Is the nipple inverted? That is going inside.
Okay.
Are there skin color changes? Maybe darkening or reddening. And is the breast maybe even one is larger than the other one? You just check generally. Then from there, you straighten up your hands.
Okay.
Or you do like this.
Okay.
Hold on the waist and check if there are any breast changes. Sometimes it's not normally always a breast. You can even get a lump below under the arm. So it is always good to ensure that you've checked your breast even every day. But what we always say, it is once in a month.
Okay.
Once in a month. For the ladies who are still receiving their menses, it is after the 7th day.
Okay.
That's when the breasts have, between the menses, you feel some pain.
Yeah.
There is always that
there's some
fullness.
changes, yeah.
So after 7 days, now you can be able to check to do the breast examination. So as we continue, now when you've already seen there's nothing you can see there, now you go to the palpation and you're using this part of the hand, the palm. The 3 fingers, though you cannot even still separate this one.
yeah.
So you start from here. So I can demonstrate with
Right.
this breast. So you start from one corner. Maybe you just say, I divide like 4 times.
Yes.
I start from here and I go. Most of our women, if you ask them, do you do a breast examination? They will just do like this. For this one, you can't feel. You must be systematic. You go round.
Is it a circular motion? as you
Yes,
do
a
that?
circular motion.
Okay.
You go round. I can be able to feel if there is a lump, like this breast of mine, I can feel that there is a lump there.
Yeah.
Just so any pain, any lump, any change in color, any nipple which has, then I check on the nipple. Is
You
there
press
any-
it.
Yes. Is there any fluid getting out from this? Then I also check around the armpit.
Okay.
Because there are lymph nodes which are there. They may be swollen,
Yeah.
but the breast have no issue. So don't also ignore this area because the lymphatic system
Yes.
around here
Okay.
is very much concentrated around here, the breast, so we must check on that. So if any client
Yeah.
identifies a lesion or any pain or change in color, they just have to come to the hospital the following day or just image it. Because most of our clients, they are ignoring the signs.
Yeah.
They have them very early, just like my sister Wampo has said. She got the signs and noted the signs very early, but only when she went to the health facility, everyone assumed it's the breast milk.
Exactly.
There is no assumption from breastfeeding mothers. We've seen breastfeeding mothers who have been diagnosed as stage 3. That means even in pregnancy, the lump was there.
It was there.
And as usual in the village, we say it is the milk which is piling up at it's early preparation.
True.
So we've always assumed that, but now we are very vigilant on that.
Okay.
Any breastfeeding or pregnancy woman,
Okay.
we will do the appropriate investigation should be done.
Okay, you've
Yes.
talked about pain, and normally I a lot of people say there's no pain. A lot of people, I don't know if Wambua you had pain at that point, and then you know Martha can tell us about that pain aspect of it. And also there's this, I think it's a myth or misconception about when you breastfeed, then chances are lower. So did you experience any pain at all?
From the awareness that I have now, when cancer is starting, it's not painful because cancer is caused by uncontrolled growth of body cells. So when the lump is very small, there is no pain because it is not affecting the other cells next to it. But as that abnormal cell grows, it starts getting pain.
Okay.
So most people ignore cancer like me because during the starting times, it is not painful.
Yes.
You just feel a lump and you assume oh, it's okay because it is not painful.
Yes. Okay, it's not painful. But Martha, speak about that pain. What kind of pain is it? Because like for women especially, during their cycle, there's pain that you can experience. So how can you differentiate between that pain and the menstrual pain and also now this cancer pain? How do you differentiate?
Okay, back to just what I have said. We just do the timing. It is from 7 days after menses.
Okay.
So that I don't mistake the pain to be the menstrual pain the fullness.
Okay.
So the 7th day, I'm comfortable that if this lady has pain, I should make sure she's followed up.
Okay.
Yeah. Because most of the time when you press a hand is when you feel the pain.
Okay.
But when you just do without pressing it hard, you may not get the pain.
All
Yeah.
right. So you apply a little
Yes,
bit of
it is
pressure.
just applying erythroforce.
Okay,
Yes.
let's talk about, because you mentioned the rural women, how then can they be able to, because at home you can imagine there's no awareness like we have in the urban areas.
Yes.
How then can these women now access such information to just save their lives early, in terms of screening and early detection?
Perfect. Like what we are doing today.
Yes.
Someone is already watching us and she will be able to do a self-breast examination.
Yes.
So creating awareness in our media, creating awareness even in the outpatient.
Okay.
Someone came for another illness, maybe my leg is broken, but maybe you can see the screen with the messages on breast cancer, especially on breast cancer awareness month. Or simply a nurse going to give a health education in the morning.
Yes.
Sometimes you find most of the waiting base, people pray in the morning and then you start your work. Mention something about breast cancer in the morning.
Okay.
So it is also trained our CHPs, the health the community health promoters.
Okay.
They are playing a very good role in the community, and they are our linkage from between the health facility and the community. If also we empower them with the information on breast cancer, of which I said I don't separate breast and cervical cancer, because the two, the woman has the two, is at risk of the two cancers. So we always try and make sure the CHP, they are also empowered, so that they can be able to reach more women whom we cannot be able to reach. And then we support the CHPs by going to do the outreaches in the community. And that is the work I have been doing for the last 18 years. Yeah.
Amazing, amazing. What you know, a lot of points, even for me, like I thought I knew something about breast cancer awareness, but really I'm learning so much from you. And to that effect, you know, we've talked about awareness, we're informing people right here. Very important thing that we're doing this morning, educating people on the importance of early screening, early detection. Now, this is also some information that we may want our brothers and sisters, like we said earlier, from Lamu, where we are not yet there, to also be part of this conversation. Why do you want to leave them out? You know, you and I can play a role just by supporting us, making sure that we are able to reach them on our frequency 88.5, you know, and by doing that, you can be able to send your support from Paybill, you know, Paybill number 316, account number is Lamu. Let's listen in to Bernard, one of our partners, and what he has to say when it comes to Lamu. We're at 7:30.
Back in the 1980s, Michael W. Smith sang about Lamu, a beautiful island paradise, but with a message that even in paradise, you can't escape the emptiness inside. Today, almost 40 years later, Family Media has received a license to bring the gospel to Lamu because the people there, like all of us, don't need an escape. They need Jesus.
Inatumani kuwe na upendo na pia na furaha kutoka kwa Roho wakati tunaona kile tumefaidika nacho kutoka kwa Family Media pia itafaidi watu wa Lamu. Kwa hivyo watu wa Lamu wanafaa kuwa very prepared kwa supernatural programs na supernatural benefits ambazo sisi tumeacquire na ndiposa tunaweza kusonga hata na mbele.
To put Family Radio on the air in Lamu, we need 3 million shillings. Would you help us make this possible? Send your gift today to M-Pesa bill number 316 and the account name Lamu, L-A-M-U.
Hii project ya Family Media kufikisha huduma kwa watu wa Lamu, tunaomba mkasimame pamoja nasi. We keep Jesus on the airwave in Lamu ili tuweze kufikisha hii target ya 3 million ili hata wao wapate huduma kama vile tulipata, na wakati ndugu yako anafaidika na pia nao umefaidika. Pamoja twende Lamu na Family Radio.
And praise the Lord. My name is Zoe Phyllis. I am born again, and I'm letting you know that this week we are having a family praise and prayer show that will be streamed across Family TV, Family Radio, and across all family socials. I will be ministering there. We will be having beautiful moments of the Word of God, of praise, worship, and prayer. You need to invite someone, and I need to see you there. Let me know if you will be coming. Thank you so much. See ya.
Praise him, raise him, name it, claim it. Every tongue that rises up against me, shame it. I breathe success in and out my lungs. Got the power of life and death coming out my tongue.
Yeah, that's Family Praise and Prayer this coming Friday on the 31st, where we'll be having our Family Praise and Prayer at 7 p.m. to 8:30 p.m. And our guest artist is the one who was talking there, Zoe Phyllis, and she'll be here to just, you know, be with us as we get into the presence of God, just helping us be there and letting God be. You know, they say let go and let God be. So that's what we'll be doing on Friday 31st. Please make sure you're part of this amazing plug when it comes to Dundaing on a Friday. Then let's talk about Lamu again. Bernard was talking about how, you know, the impact that this frequency can have. Remember, right now we are at 2.1 million. Our target is 3 million and we are 2.1, so 900 to go. And our deadline for this campaign is on the 31st of October. Please, let's work together to ensure that we achieve this dream together, to impact those lives that we are talking about, and, you know, have such conversations on air to our brothers and sisters again in Lamu. And let's get to our socials. I'm seeing there's a question here, Martha and Wambua. Someone is saying, good morning, Sally, and our guest in studio. My question to Wambua is, does she have a history of breast cancer in her family or any other? I think she means, or they mean any other cancer. And then to Daktari, is it true that people with cancer have mood swings and are normally angry, maybe due to treatment, or just wondering why them? Should they seek therapy? Thank you. So I'll start with you, Wambua, just to tell us if you have that history in your family.
Personally, I do not have any history because in my mother's side, I'm the only person who has ever had breast cancer. In my father's side, I'm the only person who has had cancer. And in the process of life and in the cancer advocacy space, I've come to learn that it's not a must for you to have an history in the family for you to have cancer, but it is a risk factor. But as for me, I have no history. In fact, I think I'm the history now in the family.
Okay, and I think that's very important because you realize, or you find that many people don't go and they say, but kwetu hatuna hiyo. You understand? So it's important that you mentioned it is a risk factor. Okay. Let's talk about Martha. She's asking, or they're asking, Daktari, is it true that people with cancer have mood swings and are normally angry, maybe due to the treatment? Because I think there's hormonal therapy, like what Wambua is going through, or just wondering why them, probably the bitterness now, and should they seek therapy? And I remember, you know, there's a time my mom died of the same ovarian cancer, and I remember a doctor mentioning that during this time she'll be very mukali, she'll be quite harsh and all that. So I think it's a very valid question. Do they get really angry?
I can respond by saying any person, when you mention that they have any cancer, that really hits them. You have so many things you ask yourself. I've been doing this to God, I've been tithing, I've been good to the village, I'm a health worker. You really ask God, was it only me who could have sacrificed the whole family? Like Wambua, she's saying, I'm the only one in the family with the history. So that's something which can make even someone so bitter. But what we do after getting any breast cancer diagnosis, we call the family. And we talk to the family. We call it a family conference. We talk to the whole family because we want a support system. Support system, that family, they are the ones to support this patient. Because this patient is going a lot in the mind, socially, financially. There are a lot of psychosocial issues. We also link this patient to other multidisciplinary team like counseling, mental health issues, because these are patients who are so delicate. And they will even notice anything small you do to them. Because they are seeing maybe you are stigmatizing them. There is always this thing in the community, now once you get cancer, that is your description. It is that lady with cancer. Now then they stop calling you Martha. They stop calling you Mercy. It's Mercy with breast cancer. You are associated with it. It keeps you very angry and you are stigmatized in the community. But once you come out like Wambua has done and be an advocate, you beat the stigma. Then there are also myths and misconceptions. So many about breast cancer. People think if there is a family history, it's a must. It's not a must. If there is no family history, you couldn't get breast cancer. No. We've heard from Wambua that there is no family history at all, but she has breast cancer. So the family history is just like 15% of the population. There are other risk factors, like having the breast cancer mutation genes, which is BRCA1 and 2, which predisposes you to more risk than any other client. Also the weight the obesity, the unhealthy eating, which we are doing, you find that you are having a lot of weight, and it's also a risk factors. So there are so many risk factors.
Nutrition?
And that's, yes.
Nutrition?
Yes, nutrition, part of it. You need to do exercise. You need to rest well.
Okay.
So that's what I was saying. As nurses, we can do a lot of advocacy and creating awareness.
Fantastic.
Making sure the risk factors are well noted by the community.
Okay.
Yes.
You've talked about, that aspect of when you received the news.
Yes.
How did you feel, Wambua, when the news, the diagnosis was broken to you? We didn't speak about that.
When the diagnosis was given to me, in fact, I was not done in fact, I just went for the ultrasound, took back the results to the doctor, and in fact, he simply told me, Eunice, this is suspicious for cancer. The next thing we should do is a biopsy so that we can confirm. Then from that, we start the treatment.
Yeah.
There was no counseling, there was nothing. In fact, I came to learn about counseling 5 years after my cancer journey.
Oh my goodness.
So, in the population, maybe in Nairobi, but I don't believe it's in Nairobi alone because I was treated in Nairobi.
Yeah.
So I strongly believe there is a gap.
Okay.
In fact, in my cancer journey and advocacy, I've traveled to several counties in Kenya. And in one county, I was told that when you are diagnosed with, in fact, they did not believe that I'm a cancer survivor and I've survived breast cancer. In fact, I was forced to remove my prosthesis for them to confirm that I'm -1 breast. Because according to them, you cannot survive cancer. So, cancer is still, it is a disease that comes with a lot of stigma.
Okay.
And it is a disease that turns your, it gives you a 360 turn to your life.
Okay.
Because for like my case, I lost my husband to cancer. In fact, he left immediately after the cancer diagnosis. In the process of treatment, my employment was terminated because the employer also believed that I was dying. So the cancer journey is a journey that comes with
a lot of stigma.
A lot of stigma.
Yeah.
And even in the society, up to today, when people, when they ask you which Eunice, they tell you the Eunice ule wa cancer. Your identity changes once you are diagnosed with cancer. So, and that one encourages me to create awareness because I've realized that people still stigmatize those people who are suffering from cancer. They even believe that since you have cancer, your kids are also at risk. There are those who will not talk to you because you have cancer. There are those who will not come near you. They will not even come to look at. Even if you meet, they will not talk to you because they still believe cancer is contagious. So as advocates, as the medics, we have a lot of responsibility to create awareness because awareness, especially in Kenya, is limited to the big cities. In the societies, it is not there. People don't know.
And of course the media also has to really play
and social media and the media. Because many people, even if you cannot come to the big city, you'll watch it on the television. So we have a big responsibility.
Absolutely.
In fact, I'm a believer in, I don't know the reason as to why God has given me 9 years after the diagnosis, but I'm a believer in there's something that he wants me to do in the society. So that is what I do these days.
Fantastic, and you are doing a good job, Eunice. You are doing a very good job. Martha, let's talk about the different types of treatment that are there. And we've also talked, she's mentioned the prosthesis. Let's talk about that as well. Yeah, because she's doing hormonal therapy, that is one. There's mastectomy, is that part of the treatment? And maybe more that you may want to share with us.
Okay, let me start from detection.
Yes.
Once we just give like an example of you get you with a breast lump. The next thing we want to know, what's your age? If you are 40 years and above, we do a mammogram for you. So it's a mammogram. Then once we do the mammogram, if below 40 years, we do an ultrasound.
Yes.
And then we find the results. When we get the results, we are able to identify if you are going to be done a biopsy. Once we do the biopsy, and get the diagnosis of cancer. We counsel our patients on different treatment modalities, which they are going to receive. Of course, you link them to the oncologist, but you mentioned you be done chemotherapy where drugs are used. You also be done radiotherapy where radioactive rays will be used on your breast. And for any treatment, it is a multidisciplinary team.
Okay.
The doctors have to have a sitting and discuss the case.
Yeah.
You cannot just decide, I'm going to do this on Wambua alone. No, it is a whole set of doctors
Okay.
who will sit down, the oncologist, the surgeon, and they'll all be discussing this case. Do we start with surgery? Do we start with treat with the radiotherapy? Do we
Okay.
start with the chemotherapy? So we individualize the care.
Okay.
So we cannot say all breast cancer cases, they are done surgery first and then they are done this first.
Yeah.
It is individualization
depending on
of
the-
each case. It's sorted according to the stage.
Okay.
Because once you do the staging, you're able to know this lady, even there are some who are done palliative chemotherapy,
Okay.
palliative radiotherapy, especially at stage 4, just because you want to reduce the tumor
Okay.
and improve the quality of life.
All right.
So in terms of treatment modalities, we individualize the care.
Okay, and I think we may want to touch on
Yeah.
on mammogram, because
Yes.
it's also something that I don't know if it's being abused or that's how it's supposed to be. It's a question we'll be discussing. But let's get to our social. Someone is saying, hi Sally, can men get breast cancer?
Oh yes. Oh yes, I've personally seen one man with breast cancer, and it comes with a lot of stigma.
Okay.
And when I identified this man,
Yeah.
he had a very small breast lump, and he was even coming to ask a question. He didn't even enter in the building. Can I be done a breast ultrasound? I asked him why. I have a small lump. You just get in, I see this lump.
Yeah.
And it was like he really didn't want.
Yeah.
Even me crossing the room and checking the breast, it took a lot of time.
Okay.
Once he was done the breast ultrasound, he did not come back to me. So after like 3 months, I called the number. I was done, and I'm now in KU
For treatment.
for treatment.
Right.
But you see now the stigma itself, he didn't even come back.
Yeah.
I had to call. So that's the only man I have seen with the breast cancer.
Okay.
And I thought it was a very, very small. Remember, men don't have any breast tissue
Exactly.
like women
Yes.
that you can palpate and get.
Exactly.
So for the men, I think even they can be able to identify better
Very
than
easily,
the ladies.
yeah.
Because as we have a lot of breast tissue, the fibrous tissue, the fatty tissues. So for the men, they feel it's a disease for women.
Okay.
So they are not even concerned with the breast. But now we are telling them, come out from that cocoon, come, we check your breast. If you feel any abnormality, come to the hospital.
Okay,
Yes.
yeah, because I know men are not very good with
Yes.
matters hospital and all
Yes,
those
yes.
things. Then there's also, I think it's a very important question. Good morning, Sally. Ask Dr. if there's any pain associated with the lump in the breast. Can one have a lump that is non-cancerous? I think that is benign. Is
Yes.
it a benign? And how do you differentiate? Someone would like to know.
Okay, any breast lump, we treat it as urgent.
Okay.
Just go to the hospital.
Yeah.
Remember, if the breast is not supposed to have a lump, we should not be comfortable at home with a breast lump. Just come, we do the ultrasound
Yeah.
or a mammogram. Then the result clearly even recommends,
Yes.
is it a biopsy to be done or it's a benign lesion? If it's benign, we just follow up with the
Yeah.
surgical team and it can be removed.
Okay.
Remember, any the cancer thrives in any abnormality. A place where there is any abnormality of the cells,
Okay.
it is thrives there.
All right.
So it's good for our people to know that cancer will not have any pain from the beginning.
Okay.
Especially the beginning part of it.
Okay.
You will not have any pain. And even there is a lot of misconception around the pain. Clients always say, I have a lump, but it is not painful. They have to put the one, it's not painful. Meaning, I should not think so much,
Yeah.
it's not painful.
Yeah.
But I always act. Yes.
Okay. Let's talk to, Eunice, talk to someone who probably they got their diagnosis yesterday and they're terrified. What would you want to tell such a person watching or listening? Because we also have people on radio.
What I would wish to tell anybody who has gotten a cancer diagnosis, it does not matter the cancer, it does not matter the stage, it does not matter your age. Cancer is a disease that is treatable. Cancer is a disease that can get cured. Cancer is a disease that there's still life after cancer. So if you've gotten a diagnosis, go for treatment. But the worst part of getting a cancer diagnosis, they are the small doctors that you get in around your homes, around your villages. They tell you, miti ni dawa. They tell you, chemo kills. What I'm here to tell you is this. I went through 8 cycles of chemo. I went through 25 cycles of radio. I went through a mastectomy. I went through TAR and BSO. That is, I removed my uterus. The doctor removed my uterus, my cervix, my ovaries, and part of the vagina. And I'm still here 9 years later. What does that mean? There's life after cancer, and you can get cured. Only that, don't go to that alternative treatment, because by the time it is not working and you are coming back to the hospital, the cancer will have adjust. So go to the hospital, get treated. I was treated in Kenya. I did not go in any other place. There is treatment in Kenya. So go to the hospital, follow the doctor's instructions, and it shall be well. Cancer does not matter the stage. It can be managed regardless of the stage. Yes.
Martha, what was the importance of that procedure, removing the uterus, removing the cervix, and all that? What was the importance of that? Or why does that happen?
Okay. The importance of integrating breast and cervical cancer screening, it's because the highest mortality we have right now is from breast cancer. The second is cervical cancer. And this woman who gets into any health facility and they want to be done a cervical cancer screening, they mostly come for the pap smear. I'm coming for pap smear. I've heard you are doing the HPV DNA testing. We are the ones, it is our work as health workers to inform them. I would first do the clinical breast exam, and then I teach you, or rather show you, how to do a self-breast examination, so that you can be doing it monthly. Then as I do, as we call it the dual screening, where I'm doing the breast and the cervical. Once I do that, I empower this woman. She has a chama out there. She'll inform the women, you know, I was shown to do this and this. And women, we are very good advocates because we integrate a lot with other businesses in the community. So that's what I was saying, I cannot separate, because this same woman who is dying of breast cancer is also dying of cervical cancer. Yes.
So the two go together.
They two go together, and we want to reduce the maternal orphans.
Absolutely.
Because we are seeing a mother in a very broader perspective. When we lose a mother in the community, we lose something very precious in the community. Remember, a woman is everything in the community. She's the backbone of the community. Kulea watoto and all that. So we are trying our best to ensure that this woman is healthy.
All right.
Yes.
Wambua, Martha earlier had spoken about support, how important support is. What kind of support do you have, or did you have back then when you are in that critical state?
One among the worst parts of a cancer diagnosis, especially for me, a cancer diagnosis in Kenya is a very lonely journey. Because as for me, I walked my cancer journey alone.
Wow.
Because my husband, in fact, he believed that my cancer diagnosis was a death sentence. So according to him, he was not willing to sacrifice any finances towards the treatment, so he packed and left. As at that time, all my other kids were in school, so I had a 6-year-old who was in the house, so that was the only person I was left with. So a cancer diagnosis is a very lonely journey. My cancer journey has been very lonely. And in fact, after I lost treatment, after I lost my job, it made me have a lot of dialogue with myself. And it made me think about my perspective of life. And that is when now I felt that mental wellness is supposed to be, I thank God currently it is being integrated in the cancer continuum, because those days when I was being treated, it was not there. And I also felt that from the weakness we have with Kenyans, when they hear it from a person who has gone through it, they take it more seriously than when they hear it from a person who has not gone through it. And so, despite the fact that I'm a biochemist, I'm a jobless biochemist in Kenya. So, with my cancer experience and the mental wellness coaching that I got, I decided to pursue a course in psychology and counseling, so that it would place me better in dealing with the other cancer patients.
Okay.
Yes.
All right. Let me bring you in, Martha, because, as we get towards the tail end of this particular discussion, are there different types of breast cancer? In terms of, there's one, I don't know, in the milk duct, there's one. Are they different?
To start with, once we get breast biopsy,
right,
there is also another test which is done, which is called immunohistochemistry. It usually differentiates the hormone, the cancer you are reacting to, the hormone affected, either progesterone
or
receptor, HER2 receptor, or the which are very aggressive. So according to the hormones, we should know the type of breast cancer you have.
Okay.
So it can affect the lobules, it can affect the ducts, or the fibrous tissues.
Okay.
So according to any breast diagnosis is when they are able to know which type of drugs they are going to start with, which type of treatment modality they will start with, and how long. And thereafter, which treatment to be done, the hormonotherapy, which is having a lot of issues in the community. You hear maybe someone who is 35 years, she has already reached menopause because of the hormonotherapy, but we still see them doing well despite the night sweats and what have you. They don't even, they go on remission for a long time. By remission, I mean they stay without symptoms of any cancer, even for 10 years. More than even 10 years. And that's our joy, because early detection, better outcomes.
Absolutely, absolutely. But, for example, if you're to do an ovarian, I don't know if that's a test, CA125, for example.
Yes.
That's a blood test.
Yes.
Now, for breast cancer, do we have any CA something, or it's just the physical check? Can blood also show if you have, a trace of cancer or something like that?
No, for the breast, it is specifically the biopsy, a tissue. But for the ovary, it is a blood test. And then also you still have to do the CT scans. Yes, because you have to do the staging.
Okay.
Yes.
You have two things there, the processes. What, could you please briefly talk about them?
Okay. This one is used to demonstrate how you do the breast examination. And then it has some lamps, so a client can be able to identify. So this one, when I teach the client, they will be able to go and demonstrate it to others. If you feel that lamp like this one, so this one maybe like a CHP maybe, she'll be able to feel, so this. So if a client, a patient or a woman in the community tells me I feel I'm blessed, it's that.
It's this one. Okay.
Then this one is for the ones who have already been done mastectomy. So we want to restore their dignity. We want them to feel like they are women. We want the community to reduce the stigma. Because once you go with a flat chest on one side, people will keep on talking about the one breast and one breast. Now when our client Wambua is here, now we are she's very comfortable because of this process. Yes.
Okay.
Yes.
Wow. I've seen actually really people are out here trying to create this awareness. I know I've seen a lady on, I think, Instagram or somewhere on social media without anything. And, both breast mastectomy has been done on both. And she's out there speaking about it, so loud. We have Eunice here, and that is amazing, Eunice. But for, our viewers and listeners who now are watching and listening in, what is your parting shot? What is your last word to them? Advice, encouragement. Speak to them briefly.
What I could tell people who are listening to us is that cancer is a disease that can get anybody. It can get a child. It can get a person of mid-age. It can get a person who is old. So the best way of dealing with cancer is going to the hospital, going for screenings, and being self-aware. Because when you are self-aware, and the worst part of cancer, it is not and sees that only gets the breast,
Yeah.
it can go to any part of the body.
Right.
So the best that a person can do to himself or to herself,
Yeah.
it is to know yourself, your whole body,
Yeah.
such that if there are any changes in your body, you'll be in a position to notice the changes and go to the hospital early, get detected early and get treatment early,
Okay.
because the early the diagnosis, the better the prognosis,
Yes.
and the better the outcomes.
Fantastic. Briefly, Martha, from your expertise, speak to our audience.
Okay, what I can say, we always talk about self-care.
Yeah.
So creating awareness, I would urge you on your birthday, do self-care on yourself. Have a pap smear done, have your breast examination done, and if you are above 40, do a mammogram. From there, you know how your breasts are.
Yeah.
Are they dense breasts?
Okay.
Are they okay? Do they have any problem? And don't ignore any sign.
Okay.
Seek help as early as possible so that we can be able to navigate you the shortest time possible, because when you need so many investigations,
Yeah.
and we can see the financial toxicity in our country,
Right.
we will not be able to assist you as we would have liked to do.
Wow.
So come early, as Wambo has said, early detection, early diagnosis,
Okay.
and better outcomes.
Fantastic.
Yes.
I think this conversation requires much more. We've actually just scratched the surface. You both know that there's so much you need to discuss on this, including that mammogram you're talking about. But I pray that God will give us another chance to have this conversation, to keep impacting lives and continue doing the amazing job that you are both doing, right now, and impacting the society. Thank you very much for your time. And to you, our viewer and listener, I want to thank you so much for just being part of this conversation. Remember to be part of this support. Then you can do that through paybill number 316. Our account number is, your telephone number. And also we have our cooperative bank account number. And you can do that through 0113-6000-799100. And the account name is TBN Family Media. God bless you even as you purpose to give towards this amazing ministry. God bless you. See you again tomorrow. Bye. Hallelujah.